Hi everyone, sorry for the delays. Are you all able to hear us now? We've all turned off our video in case that was the problem. Okay, great. So it looks like everyone is able to at least hear us. So we will keep the video off so that we don't take up any more of your time. And we will at least address some of the questions so that we can get answers for you all. And if we run out of time and aren't able to answer all of the questions today, we can send out an email after with answers to the questions. So the first thing I want to do is welcome you all to Community Voices, New Hampshire's Next Steps. Thank you for joining us this morning for our half day of sessions, talks, and this panel. We'll get started with some introductions. My name is Jessica Hillman, and I am the Public Health Associate with the City of Nashua Division of Public Health and Community Services, and I'll be facilitating the panel. Beverly, would you like to briefly introduce yourself again?
Certainly. My name is Beverly Drouin, and I work at Public Health up in Concord. I am the administrator for the Healthy Homes and Lead Poisoning Prevention Program. I too live in an old house, 1840, and I accidentally poisoned 2 children in my house. Thank you for having me.
Thank you for that introduction. And Kim Bernard, would you introduce yourself?
Hi there, good morning. My name is Kim Bernard. I'm the Chief Public Health Nurse for the City of Nashua, and I recently took over as coordinator for the lead program.
Thank you for joining us. And Carrie, would you introduce yourself?
Hi, hopefully you can hear. Carrie Schena, City of Nashua. I oversee the Urban Programs Department. It's part of community development, and we have a large focus on improving housing stock in the community, as well as assisting neighborhoods and nonprofits to improve lives of our residents.
Thank you for joining us. And Dr. Capetta, would you introduce yourself?
Yes, I'd be happy to. Good morning, everyone, and hope you've all enjoyed this wonderful conference. Sorry about the technical glitches. My name is Chuck Capetta, and I'm a pediatrician at Dartmouth-Hitchcock for the past 30 years and a member of the National Public Health Department Board of Health physician member.
Thank you for joining us. And Rob Crowley, would you introduce yourself?
Hi, good morning. My name is Rob Crowley from Crowley Realty. We're a local real estate company. Property management. We lead program on a regular basis.
Thank you. And it sounds like it's a little bit hard to hear you. But thank you for joining us. And we will get started with some of the questions we have for today. And one of the first things we wanted to talk about was a question for Dr. Capetta, which is, when should we start thinking about lead exposure in childhood?
Well, it's never too early to start thinking about the answer to that question. So to paraphrase one of my favorite medical role models, Buzz Lightyear, from the Disney Pixar's Toy Story movies, from pregnancy and beyond, I'd like to say. So it's, we know lead has an effect in pregnancy with potentially gestational hypertension or blood pressure, potential spontaneous abortions, low birth weight, and other problems. For me as a pediatrician, I really get, from the moment the baby's born, I really start talking to parents about their own individual and family lead exposures, as we heard about today in multiple talks, and all the ramifications. And in the old days, which in lead years, but for me, less than 10 years ago, we used to do finger pricks or capillary lead tests. And we thought that when we got the lead was a little bit high, it was just part of the fingerprint, and that's okay. But now we know better, and there's no such thing as a safe lead level. So that's my quick answer there.
Thank you for sharing that information. And it looks like Elizabeth Hannagan has been able to rejoin. Some of the people might be familiar with her from her earlier talk, but would you mind just briefly introducing yourself, Elizabeth?
Sure. Hi, my name's Elizabeth Hannagan, and I'm a home visitor with Healthy Families America through Community Action Partnership of Stafford County. I'm also the parent of a lead-exposed child.
Thank you for that introduction. And Rob, would you like to just one more time try introducing yourself and try to speak loudly if at all possible?
Sure. How is this? Can you hear me now?
It's still coming in pretty quiet. So I'll come back to you if you don't mind, Rob. And in the meantime, while we're trying to get that sorted out, I have a question for Elizabeth, which she answered a little bit earlier, but I don't think anyone was able to hear her. So I'm just going to ask her, what should parents know about lead?
Parents should know that even very low doses exposure between 3 to 5 micrograms per deciliter can lead to devastating consequences. So they should tap into their community resources. The public health system really helped our family be able to navigate the complex scene that lead exposure creates when it comes to remediation and then interventions. So I would tell families that they need to tap into their resiliency because it's a long process. It takes a long time to be patient, to practice from a space of hope, but to really utilize the community resources. New Hampshire has amazing community resources around helping families, and families can engage with those systems to better address the issue. And then the other thing is that the length of time of exposure is very important. We didn't understand that in the beginning. And had we understood that better, we would have sought to remove the source of the exposure faster. And so, or remove ourselves from that by going into a different housing option.
Thank you. Thank you for sharing. Another question we have is for Kim Bernard. We would like to know what happens when a child has an elevated blood lead level. What should parents expect from public health, and where can children get tested?
Sure. Can you hear me? Can you hear me?
Yep.
Okay. Just want to make sure I had some audio issues. So the state will get all of the lab results. And then what happens is the state sends, the Nashua Department of Public Health and Community Services sends us those lab results. So for the greater Nashua area. And as Dr. Capetta explained, no level of lead is, safe in our bodies. So when a child has a lead level greater than 3, we reach out to parents. We provide education, and this education includes talking about what risks may be potential risks for that child, resources, and also prevention, so that we can prevent that level from going up anymore. We also notify the property owners, but we do not disclose names of clients. We protect their privacy, but we notify them so that they're aware and can take measures. And if a lead level is greater than 7.5 currently, this is considered an actionable level. And what we provide is case management at that point. And what this looks like is that a nurse will complete an assessment. And prior to COVID-19, we actually did a home assessment where we'd go with a community health worker and a nurse, and we'd go into the home and assess that child and their environment and talk with parents and guardians. But right now what we're doing is we are doing phone assessments. So we're assessing over the phone, talking with the parent or guardian about development, nutrition, concerns about the living conditions. We ask about where the child spends their time, what occupations that maybe the adults in the home have if they're exposed to things that could potentially be risk for lead poisoning, cultural practice, and such. So the nurses are really thorough. And then on top of that, a lead inspector who actually does go out to the homes continues to do so, and they do a complete home inspection. We also at the Division of Public Health and Community Services, we provide cleaning products to the parents if needed, and and the education that goes along with that as to how to clean the home. And the second question was about testing. As you know, we recommend testing for ages 1 and 2, but we also will test any children, typically up to the age of 6. Children can get tested at their doctor's offices. We also provide testing through the Nashua Division of Public Health and Community Services. Currently, right now, we're undergoing some building renovations, so we are being creative with our outreach. So we are out in the community, and we provide access to lead testing at all of our outreach services. So currently, we have clinics Tuesdays, Wednesdays, and Fridays at various locations, and further information can be found on our website, which is www.nashuanh.gov/DPHCS, or by calling us at 589-4500, and we can give you all that information over the phone.
Great, thank you for sharing that information, Pam. Another question we have for you is about what is Nashua doing to prevent lead poisoning? So you mentioned testing available through doctors and through the Division of Public Health and Community Services outreach. Is there anything else going on that people should be aware of?
Yes, sure. So yes, testing and getting the word out about testing through messaging. So we do a lot of messaging through the greater Nashua area through means of social media, billboards. We have a magnet for our van. We also talk about it on our radio show. We also work with community partners surrounding lead, such as HUD. We work with the state. We work with the school nurses and our pediatricians. And through our other outreach efforts as well, such as attending health fairs and other events throughout the region.
Great, thank you so much for sharing that information. And we'll also be sending and have sent some information to attendants of this conference on getting involved with our community initiatives, including our maternal and child health work group, which we encourage any interested community members to join. And regularly checking our website where we post upcoming events such as this and such as outreach events, and we'll be sending out further information to participants as well. But thank you for sharing that, Pam. Another question we have is regarding housing. So Carrie, the question is, are there housing options or grants available to homeowners or renters who are impacted by lead poisoning?
Yes, there are, in short, to answer that question. And I'm not sure if it was stated earlier in the conference. I was bouncing around between sessions, but much like a couple of the other communities, Nashua was just notified on Friday that we've received a new grant from HUD. It's a 42-month grant, and we've been awarded $5.7 million. So this is incredible. It's going to be a huge opportunity to really get in and do a deep dive and make a big difference in our housing stock. And as it's been stated throughout the day, we're going to do this through all kinds of levels of partnerships. Public health, of course, being our strong partner. They're going to be in the community and boots on the ground. And then landlords like Rob Crowley, we hope will participate, but we really encourage everybody to give us a call or give any of these partners a call, and we'll walk you through that process to get, we're hoping to do about 250 housing units under this grant and make those lead safe for our young kiddos.
Thank you for sharing that information. And speaking of Rob Crowley, would you like to try to introduce yourself again? And we'll see if your sound's working.
Can you hear me now?
Yeah.
Yay.
Yeah, you can?
Yes.
Oh, great. So my name is Rob Crowley from Hinch Crowley Realty. We're a local real estate company. We do property management, and we're also an investment group. We participate in the lead program a lot with the city of Nashua, as well as some other towns in the southern New Hampshire area.
Great. Thank you so much for joining us. And a question we have for you is, what should landlords know about lead?
I mean, aside from the danger of, your tenants and their children getting poisoning, there are many other things that it affects you on. Banks are getting more strict with financing. Section 8, if you get Section 8 housing, they're also looking at that as well. So there's a lot more expense and a lot more issues with refinances or sales. Obviously, if the housing prices can benefit from having a lead safe building. I think owners will also know that there is a difference between lead safe and lead abatement. I think a lot of times that's not really understood, where lead safe, you still might have lead in the property, but it was deemed safe at the time that it was tested for peeling paint or things like that. Generally, your high friction areas like doors opening, windows opening, usually get abated, but your higher stuff in the exterior just gets covered. So you still have to disclose to your tenants that you still have lead, even though you've certified through the program. So that's important to point out.
Yeah, thank you for sharing that information with us. And another question we have is for Beverly Drouin, which is, why is lead poisoning such a big concern in New Hampshire?
So that's a big one. So New England has the oldest housing stock in the United States, right? Christopher Columbus just landed down the road. I mean, we're the oldest part of the country. And so we have communities that have neighborhoods or sections of communities that have 80% of their housing stock is lead. And then we have communities, on average, the state's just hovering around 60% of our houses have lead in the housing stock. We take great pride in our architecture here in New England. We brag about how old our house is. I think that our culture of independence here has generally up until the last decade has probably hindered our legislative progress. I think that Dan Feltus and some of our legislators have done a great job. I think our governor just did a great job of putting the Senate Bill 247 through. But I think it's mostly invisible to people. I think that, Elizabeth touched on that earlier, that unless you're in this industry, unless you have a child who has lead poisoning, it is invisible to most people involved with early childhood education. So it's highly invisible to most of our school districts. It's highly invisible to the people who are special ed. It's highly invisible to most property owners, I think. I think we're doing a great job of bringing it to the forefront, but I think we have a long way to go. In New England, the culture of property ownership, I think, is changing. I have a sense of that. I think we're losing I'm happy we're losing. We're doing away with the ma-pa, people who own one or two rental units. Like, the husband died and left his wife the house, and she lives on one side and she rents the other. So renting apartments is a business now. There's so many regulations with it that are really important for people to know. In 2018, we had 2,600 children in the state of New Hampshire who had a blood lead level over 3. Okay, so 3 is the level that we send out notification letters to property owners and parents. We have just under 1,000 children who have blood lead levels over 5. 5 is the level that the Center for Disease Control recommends medical intervention. So those children, it might be a bit dramatic, but when I give my grocery line speech, I say, imagine 2,600 children going through the windshield of a car and the school district not knowing that that child has a brain injury. It's a real disconnect. I think people are just on the very early end of making the connection. Charlene said something early about people in a community have to be engaged. Well, when children have a brain injury and they fall between the cracks in the school system, eventually they're going to land in the juvenile justice system, and they're not community members who are engaged. So I've been in my position, 12 years now. So I'm seeing multi-generations of a family with lead poisoning. Grandma was poisoned, mom was poisoned, and now the baby's poisoned. And what do you think that baby's going to grow up and do? I mean, we could very well have another generation of poisoning. So why is that a big concern? Let me try to wrap it up. We have a ton of lead houses. We have a culture of independence here. Though we have a statewide collaboration that's doing really good at getting the word out, and we've now funded 12 public health regions, the greater Nashua included, to do primary prevention strategies. So there'll be 12 little lead clubs all over the state. We have a long, long way to go. Our legislation in 2018 had some really good things. We lowered the notification level to 3. We lowered the action level down to 7.5 micrograms per deciliter as of last summer. And then this coming July 1st, it'll go down to 5. But we also took steps backwards. We lost the ability to go into every unit into a building. So if you go into one unit and there's a poison child and all the other units are of similar architectural style, we no longer have the ability to go in those units. They need to have a child under 6 or a pregnant woman in that unit. So, that's legislative changes, one step forward, a little step backwards. But that's kind of my big picture thing. So I hope I hit the nail on the head a little bit there.
Yeah, thank you. Thank you for.
I think that's how I wrap it up.
And just a reminder for anyone listening, feel free to enter any questions you have in the Q&A box and we'll be able to address them. We have a couple right now. So one question from Bobby Bagley is, what ongoing messaging should we be pushing out to the community, stakeholders, and our legislators locally, regionally, and at the State House? So that question has multiple different components to it. And I believe it's been touched on a little bit, but I'd love to hear from Elizabeth Hannagan about the community side of that. What sort of messaging should the community and parents be seeing about lead, if you have any insight on that?
Sure. I think the messaging that parents need to hear really should start from birth, about these hazards that exist that can lead to brain injury. I'm a child of the 80s, and so I just kind of grew up thinking lead was all around us, and it's just something that's there. And what I think parents really need to hear is this can have a serious impact, and it's preventable. And as parents, we can advocate for ourselves. We can ask questions about the buildings that we're renting. We can have relationships with our landlords that allow us to address concerns. We can have great landlords on board like Rob or like my landlord who are going to come in and become partners and stakeholders in the abatement process. And I think some of the messaging should definitely be around how do we as parents, how can we best take action? Because the processes and the systems that are in place right now take a really long time. So having the public health person say to me, put duct tape here. And we did. We lived for a whole year with duct tape everywhere. And our landlord was okay with that. But being able to have those very specific action steps that I could take to help protect my child while we were fixing the problem.
Great, thank you for sharing that. That's very useful to know. And another aspect of that question is the messaging that should be pushed out more regionally and to the state house, which I think, Beverly, I think you touched on a little bit, but do you have anything that you would like to add to that question on messaging regionally and to the state house for lead?
Yeah, I do. So Bobby, when I think of, I seem to be talking in golf analogies lately, like a short game is putting and a long game is a drive. So golf is a long game, but it's such a long game that people get overwhelmed by the cost of abating all the housing units in the state. So they think the problem's so big that I just can't do anything, so I won't do anything. And so you have to break it up into smaller things that local communities can do, policies they can implement, or legislative changes, but we have to break it into small steps, because if we don't start, because we're so overwhelmed by it, it'll never get done. So I know that the Conservation Law Foundation and New Hampshire Legal Aid, they are the conveners of our statewide lead collaborative. And I know Carrie is on there at times. I know, we all participate. It meets 4 or 5 times a year. As a group together, they try to determine what's feasible, take the political climate, what's feasible to try to push through at this time. So they wanted to, an example was that they wanted to push through some essential maintenance practices at one time. So every time a landlord turned over an apartment unit, they're already doing some work, that they would use let's say work practices, and eventually every time they turned over a unit, they might replace a bathroom, or they upgrade a kitchen, or replace a window. Eventually that lead would just be removed from that apartment over the decades. I know that they're considering some water legislation right now, or before pre-COVID they're considering, and they wanted also to, Elizabeth touched on this earlier this morning. So between the time a child has a poisoning and the time that the lead is abated from a rental unit can be years, could be a decade. And very often the family moves, but sometimes the family lives right there. They want to put in some legislation, entertain some legislation that if a property goes under administrative order, that they are responsible for moving the child out of that unit right then. And while they're applying for the HUD grant, while they're trying to figure out the mechanism for the abatement. The problem is you've got to balance that, which is very well intended, with available housing and the burden it puts on landlords. So it's a very, very delicate balance. So we try to do our messaging through the Childhood Lead Stakeholders Group. All 12 public health regions are all meeting now 3 times. We're meeting on October 6th. Nashua will be part of that. And I think together we try to make sure we have a uniform message to the legislatures and the state house. But right now, COVID has kind of preempted everything. Anything that had some momentum, the momentum has been lost right now. That's a little broad, but Bobby, I hope I answered it for you.
Yeah, thank you for sharing that information. I think there's one more component to that question, which is looking at it a little bit more locally. What sort of messaging should we be pushing out to reach locally, landlords, realtors? Is lead something that home buyers are thinking about? Rob, do you have any thoughts on that?
Yeah, I mean, I think from the investor side, I think people are looking at the lead hazards. I think on a residential side, for people that are just looking to buy a house, are probably not as savvy or looking at that as in depth. I mean, everybody gets the lead disclosure forms, but I think not everybody who's going to live in the house and raise a family has a lot of deep knowledge as to, say, an investor who is looking to rent out a property. So I think, that could be an avenue to really focus on trying to give more attention to for, homeowners that are going to live in their house. And a lot of these houses are old, whether they're investment homes or just homes. So that the lead levels are still going to be there.
Yeah, thank you for that feedback. So I think that answers Director Bagley's question. She also put in a comment about how the Division of Public Health and Community Services in Nashua has a legislative breakfast for substance use disorder, and suggested that we should have one at the mid-year for lead poisoning prevention. So it sounds like that's something that participants can keep an eye out for. Like I said, we will be pushing out more information after this conference, and we regularly update our website with information. Additionally, for anyone who is experiencing technical difficulties, I put this in the box, but these presentations will be available for the next 30 days on this platform. You'll be able to go into the agenda and view the recording. Additionally, we are downloading the presentations and we'll be uploading them on our website with any further information, contact information, PowerPoint slides, anything else that might be useful to participants. And there is contact information on our website if you would like to reach out directly to the division to find out more about how you can get involved. So I just wanted to let everyone know about that. At this point, I am not seeing any further questions in the chat box. And I know due to the technical difficulties we were having earlier, we are running over just a little bit. So I would love to address any questions that come in. However, if there aren't further questions, we don't need to take up much more of your time. But I do want to thank all of the panelists and the speakers today and everyone who participated in this conference, because it was really great to hear from everyone and get your feedback and perspective so that we could continue to work on our future goals and objectives for preventing childhood lead poisoning in the greater Nashua region. Do any of the speakers or panelists on the call right now have any last words or anything else that they think is important to get out to attendees today?
I just wanted to say to everybody who's working on this issue, thank you so much for your hard work. It really is important, and I had no idea till it impacted my family, the impact it can have. So thank you for the work that you're doing.
Great, thank you. Thank you, Elizabeth, for joining us, and thank you everyone who's been on this call and who's been attending and participating. As I said, look for an email from us with further information, and feel free to go into Excel events or our website to view these presentations, any sessions you weren't able to view or any sessions you had technical difficulties with. They'll be available on Excel events for the next 30 days and then on our website. So thank you all so much for all the hard work that you are doing and for your time today. We look forward to hearing more from you in the future, and we will be in touch soon. Have a great afternoon.
Bye, everybody. Bye, everybody.